Welcome to Let's Talk About CRPS, a podcast brought to you by MTI directly from Italy. We will talk about the latest news and treatments, patients' experiences, and exclusive interviews of CRPS experts. Don't forget to subscribe to our YouTube channel and visit our website crps-treatment.com. Let's take off!
Welcome back here by Marco, here already on the mic to talk again with my guest beside me. I'm talking with Emilie Rigaud, a commercial and communication responsible for the MTI Medical Tourism Italy, ready to go deep into this story of their team. So before starting, I want to introduce you to follow all of our socials on the web, but for first, welcome back, Emilie. Ciao.
Ciao.
So let's start from the definition, the simple definition of your team. What is MTI?
So MTI is Medical Tourism Italy. It's basically the first company in Italy to do inbound tourism. So having medical patients, international, coming in Italy for treatment. Okay.
What is the story? Where all this story begins?
So it began with Claudio Pacanaro, our CEO, who has a big past in the hospital field, let's say, and the medical field, and he had this dream of helping patients, in particular with chronic pain, for his specific story. And the dream began it was thought way before, I think, since 2005, but it began really in 2013. And it just started this dream of his that is really to help international patients to have access to the Italian healthcare, which is one of the best healthcare in the world. So it all started with him, and then slowly the team just really got built around this. But he's really the core of this business, because without him we wouldn't have all the contacts and the information and the knowledge that we have on the medical field right now.
He possesses a good background about this.
He has an amazing background. Yeah. His knowledge on the medical field is infinite. And that helped a lot of us.
It is necessary, I think.
100%. Yes.
Okay. So how does MTI work?
So how does it work? Basically, we have international patients contacting us with diverse conditions. In particular, we work with chronic pain, in particular with CRPS. We've talked about it in the last podcast. They contact us, and then we are basically just a bridge in between them and doctors here in Italy. So what we do is, depending on everyone's case, we go research the best doctor and the best facility that we can in Italy to help the patient with a treatment plan, which is usually a multidisciplinary treatment plan, because we have seen now with all the years in medicine that is one of the best approach, just multidisciplinary
Probably
approach.
The clients doesn't know anything about Italy.
The patients usually don't know anything about Italy. They are looking for new answers for, medical wise too. So they probably don't even know what kind of treatment they're looking for in a lot of cases. So we are really just a bridge in between the knowledge on the medical side and of course everything around it, because we do take care of the accommodation, the meals, the transport. We have interpreters, so we really take care of everything, not just organizing the treatment plan. So it's one of two things. We do have a huge knowledge on the medical side, so we will find you the best treatment plan, and we will also find you the best accommodation that is going to be close to the private clinic where you're going to be. You'll have mother tongue speakers, interpreters with you. Transport, of course, in Italy we know people drive insanely.
Do you need a source video call to know what are the first informations about the patient before starting the plan?
What do you mean?
Is there a video call? Is there a first connection, a bridge?
Yeah, so what we do basically, we offer a free video call at the beginning so that we have the chance to meet the patient, understand their case more specifically, and then they can also understand what we do, because it's very unique. So I think it's very important to understand from both sides what is it that we do and what is it that they need. Then of course we need to be talking to medical staff. We're not, and none of us is really a doctor or so. The first step is understanding the case, and we have enough, medical knowledge to understand the case and understand where to go ask. But after that, of course, we're going to give everything in the hands of the doctors for the actual evaluation of the case and to understand what kind of treatment plan we would move forward with.
Sure. So what happens next? What happens where the client and probably his or her family come here in Italy?
Yeah, so they usually do come with a caregiver or families, it really depends. When they come here, really everything is sorted out for them. So from the moment they come at the airport, we have someone picking them up. We'll bring them to the hotel, we'll explain a bit everything on their treatment week, we'll give them a timetable, understanding what is going to be happening every single day. And then daily, they'll have someone who's going to go and pick them up at the hotel and then bring them to the clinic for the treatment. Bring them back home at the hotel. If they do want, we do organize some tourism afternoons too, so we'll take you around in the cities around the areas where you are, of course, to show you some things around. We are very specialized in welcoming people with difficulties to even for walking or anything, so we do have our own wheelchairs, crutches, so we know how to organize everything in a way that the patient is not going to be tired, and it has to be a stress-free experience, which is what we really excel in.
Okay, I want to be sure about this, the important detail of yours. Is there always a person supporting the clients all around the trip, all around the vacation?
Yeah,
in
100%. Either it's before, we do have one person they call patient care coordinator who organizes every single thing. So they will take care of the more bureaucratic part and organize the whole week for the patient and everything with the hotel, the clinic, and just really everything, paperwork, whatever. And then during the time here, they're called patient managers, and that's the one who's going to be with them all of the time, except, you know, at the hotel when they sleep at night.
There's always a privacy.
But the rest of the time they will always have someone with them. It's really important to know that you have this support both for the language and just really moral support. It's really important for us.
Okay. So let's have a sign. Let's have a conversation about the team roles about MTI.
Okay, so very young team. We're all pretty young and super energetic people.
Okay.
It's divided in different areas. We do have the more IT area for the website and just everything around. We are online. We are what we call an e-commerce, just because everything goes through the website online. And then we have a department that is more in the marketing, which is my department. So we take care of the communication and really pass the message to everyone all around the world of what is it that we do. Try to give them this peace of mind that they will come here and they will be welcomed by a team that knows what they're doing, and just give them the peace of mind of you're going to be in good hands. So that's a very difficult job, but I think we're starting to be a bit, better at it, at showing what is it that we do, including with social medias and everything. And then of course we have the team of research. We have a lot of people doing research in the team that is very important, just to be always on top of knowing whatever is happening in the world, both in chronic pain, in treatments available all around the world,
just
in
to have
any
world-scale knowledge about it.
No, exactly. It's really important. And then of course we have everyone around the patient. So like I was telling before, the patient care coordinators and the patient managers who are either organizing the trip or with the patients.
Sure. Emilie, what is needed to assist a foreign client of yours?
So we select our team members really specifically because we need them to be very empathic. They have to be caring. They have to have a huge knowledge on what the conditions are. So of course we're not doctors, we're not nurses, but we have a really good knowledge on the medical field, in particular for the conditions that we treat. So they need to be knowledgeable on any conditions that they will follow. They need to be caring. They need to be good drivers. They need to be good with languages, of course, and they just need to have a good human connection, because these people fly from all around the world to come here, and they put themselves in our hands 100% with just blind trust.
Sure.
And we need to repay this trust. We need to make sure that the trust that they put in us was earned.
Sure.
We need to have very, very specific people.
Okay.
And the selection is,
Okay. What is the feeling of yours when you all conquer this kind of goals? I mean, when you assist, the feelings, the emotions, all of the luggage of them.
So it's, I think it's probably the reason why all of us do what we do. Just coming back home at night and knowing that we've helped people. Some of the people that we help, especially for CRPS, you know, it's one of the most painful condition in the world. I have seen children, I have seen kids of like 9 years old who can't even walk, and then after a few months the parents are like, you've completely changed their lives and everything. It's just, there's no words, absolutely.
Okay.
I can't even put words in it. It's just, we know that we're doing something that matters and that helps people, and we're trying to do it in the best way possible, and I think it's just, it's amazing.
Okay.
Yeah.
I'm happy to hear your answers by this kind of hype, this kind of happiness. Okay.
Yeah.
I'm glad to have talked to you again.
Yeah,
Okay.
thank you for
See you
having
soon.
me.
Okay.
Thank you.
So we have we have just talked with Emilie Rigaud, a commercial and communication responsible by MTI. Ciao da Marco. See you soon. Bye bye.
StoryTime, Evoluzione Radio.